Hi, and welcome to today's Daily Chronicle. Today is Monday, October 27th, 2025. In the rural South, where Medicaid has been a lifeline, residents brace for cuts. Rosie Brown, Executive Director at East Carroll Community Action Agency in Lake Providence, Louisiana, said many people in the area struggle to make ends meet. Medicaid expansion was a lifeline for the town. Now, she said, President Donald Trump's tax and spending bill could snatch it away. East Carroll Parish sits in the northeastern corner of Louisiana, along the winding Mississippi River. Its seat, Lake Providence, was once a thriving agricultural hub of the region. Now, charred and dilapidated, building dots the small city center. There are a few gas stations, a handful of restaurants, and little to no industry. Mayor Bobby Amaker, 79, remembers a time when you couldn't even walk down the street in Lake Providence's main business district because there were so many people. It's gone down tremendously in the last 50 years, said Amaker, a Democrat. The town, it looks like it's drying up. Now, East Carroll residents stand to lose even more with the pending cutbacks to Medicaid, which covers many low-income people in the region. Like many people in Louisiana, they receive a lifeline when the state expanded Medicaid in 2016. Expansion drove Louisiana's uninsured rate to the lowest in the Deep South, at 8% in 2023 for working-age adults, according to state data, despite it having the highest poverty rate in the U.S. that year. State health data show the number of people on Medicaid in East Carroll Parish increased from 53% in 2015 to about 64% in 2023, according to state health data. Many now worry those gains in coverage could disappear. The tax and spending bill President Donald Trump signed into law this summer includes nearly $1 trillion in cuts over the next decade in Medicaid, the joint state-federal health insurance program for poor families and individuals. Researchers from Princeton University estimate that 317,000 low-income Louisianians could lose health coverage because of the new law. More than 30,000 Mississippians, too. That state has refused to expand Medicaid. Lake Providence Mayor Robert Bobby Amaker, without Medicaid and Medicare, he says, many people in his town wouldn't have any kind of health care at all. The tax and spending law now imposes new work reporting requirements on Medicaid expansion enrollees and will make them verify eligibility every 6 months instead of yearly. This requirement, among others, won't kick in until 2027, after the midterm elections. It also limits a key financing strategy, known as a provider tax, that states rely on to give more money to health providers. Nationwide, about 10 million people are expected to become uninsured over 10 years because of the law, according to the Congressional Budget Office. Across the Deep South, Louisiana was the only state that expanded Medicaid. The way I've described this law right now is we know there's a hurricane out in the Gulf, said Richard Robertson, President and CEO of the Mississippi Hospital Association. We don't know exactly what the category of the storm is going to be at landfall, but we know we need to be prepared for it. Struggling rural communities brace for impact. In the Delta region, which includes communities in both Louisiana and Mississippi, the impacts are expected to be damaging. Louisiana, where almost half of the state dependent on Medicaid in 2023 could lose up to $34 billion in federal Medicaid dollars in the next decade, according to KFF, a health policy research group. Mississippi could lose up to $4 billion. The physician community spoke out pretty heavily against this, said Dr. Brent Smith, a physician at Delta Health System in Greenville, Mississippi, about 50 miles northeast of Lake Providence across the river. The fact that it still went, though, was a real sense of disconnect with what our legislators are doing and what we, as a healthcare community, feel like is the reality on the ground. Residents of the Delta say they feel similarly distraught and are wondering how Congress could be so blind to how much they are struggling. Dr. Brent Smith left, a physician at a primary care clinic at Delta Health System in Greensville, Mississippi, laughs with a coworker. Why do you want to knock someone who doesn't have anything and you already got everything? Said Sharila Irvin, who lives 20 minutes up the road from Lake Providence in Oak Grove and has Medicaid coverage. It's going to be real difficult when the law goes into effect. Irvin, 58, has been working at Oak Grove High School in the cafeteria, serving hot plates to children for 25 years. She says it's one of the good, steady jobs available in this area, but her income is only around $1,500 per month. Her job offers health benefits, but she can't afford the premiums on her salary. She relies on Medicaid for care, including medications for her high blood pressure. She said the new work reporting requirements are completely unfair, and she's worried she will accidentally lose her Medicaid. My coworkers are talking about it every day, Irvin said. A lot of people probably won't even know until they go to the doctor and they don't have any coverage. In East Carroll Parish, finding a job, let alone a good paying one, with health benefits is difficult, says Rosie Brown, Executive Director at the East Carroll Community Action Agency, a nonprofit that helps low-income people with their utility bills. Many of the jobs available in town pay minimum wage, just $7.25 an hour. We have one bank, we have one supermarket, Brown said. Transportation isn't easy either. Even a full-time job doesn't guarantee health care coverage. Nevada Quails, 25, earns $12 an hour, working as a cashier at City Hall in Lake Providence. She qualifies for Medicaid expansion coverage, which is good because she can't afford the premiums for private insurance. Because of the new Medicaid law, the mom of two will have to work extra hard to keep her coverage. Quails will face regular work reporting requirements, more frequent eligibility checks, as well as a quarterly wage check that Louisiana Medicaid already conducts. It's going to be stressful, Quail said. It's another thing to add to my load that is already heavy. A massive burden for states. States will be required to implement work requirements by January 1st, 2027, giving them less than a year and a half to build a reporting system and raise awareness among enrollees. Depending on how Louisiana's work reporting system functions, researchers estimate up to 357,000 people could lose coverage. The law will now require adults who get Medicaid through expansion to prove they are working or volunteering for 80 hours a month or going to school part-time to keep their coverage, unless they qualify for an exemption. But data show most Medicaid enrollees are already working, KFF reports. When Arkansas implemented Medicaid work requirements in 2018, the first state to do so before a court struck it down. About 18,000 people were disenrolled in less than a year, many for paperwork reasons, says Benjamin Sommers, a health economist at Harvard T.H. Chan School of Public Health. And there was no evidence that work requirements have a positive impact on employment, he said. We are leveling this bureaucratic red tape on people, the vast majority of whom are already doing the things that we supposedly want them to do, Sommers said. Courtney Foster, senior policy advisor for Medicaid with the nonprofit Invest in Louisiana, said it would be a really big lift for states to administer the new Medicaid work reporting systems. The hope is that Louisiana really engages with people on the ground, as well as with community-based organizations that work with people who are covered by Medicaid to create a system that actually works, Foster said. Let's make sure that we can mitigate as much harm as possible. Mississippi is also getting ready, said Robertson, at the Mississippi Hospital Association. Without Medicaid expansion, the state's enrollees won't be subject to work requirements. But the law's financing changes to the Medicaid program could strip hundreds of millions of dollars away from hospitals, said Robertson. Why are we going back? Jennifer Newton is the executive director of the Family Medical Clinic and Community Health Center in Lake Providence, Louisiana. The law did create a $50 billion rural health fund, meant to offset spending cuts and help keep rural hospitals open. Robertson said Mississippi is applying and believes the state will be awarded at least $500 million over 5 years. But if those funds don't make it to struggling hospitals, they could either close or significantly cut back services, he said. From her small, sunny office in East Carroll Parish, Nurse Jennifer Newton, who oversees the Family Medical Clinic in Lake Providence, doesn't understand the attacks on Medicaid. The Community Health Center is one of the few providers in town, and half of its patients are on Medicaid. Newton, who has worked in healthcare in the area for decades, saw firsthand how Medicaid expansion made it possible for more patients to afford the care they desperately needed. It's absolutely helped, she said. Absolutely. In 2015, the year before Louisiana expanded Medicaid, the uninsured rate amongst working-age adults in East Carroll Parish was nearly 35%. By 2021, that number was 12.7%. Why are we going back? Newton asked. We've made so much progress. First came the Louvre heist, then came the memes. It was the heist heard around the world, so naturally it was only a matter of hours before it transitioned into memes seen around the internet. 4 masked thieves, 9 priceless pieces, all stolen in less than 7 minutes from the world's most famous museum. The October 19 daylight robbery at the Louvre has already been compared to a Dan Brown novel, or the latest installment in Steven Soderbergh's Ocean's film franchise. Now, it's something else entirely. Internet culture's newest obsession. From brands to influencers to actors with projects to promote. Here's looking at you, George Clooney. The Louvre heist has become the latest template for going viral. The Paris prosecutor said on Sunday that a number of suspects have been arrested over the theft. The prosecutor said that investigators made the arrests on Saturday evening, adding that one of the men taken into custody was preparing to leave the country from Roissy Airport. One twist came earlier this week, when Empress Eugenie's diamond and gold-encrusted crown One of the stolen items was found damaged near the scene, apparently dropped or abandoned during the thieves' escape. 8 other jewels, all relics of France's imperial history, remain missing. The estimated value of the items is $102 million, though France's Interior Ministry described the jewels as priceless. France's culture minister called the theft a humiliation. The museum's director admitted that the heist was not inevitable, acknowledging the failure of its security. The Louvre's protection systems are expected to face more scrutiny in the coming weeks, particularly as questions grow about the lack of security cameras in the museum's Apollo Gallery, where the robbery took place. Turning crime into content. The thieves entered the second-floor gallery via a window using an electric lift, which they also used to scurry back down to the ground level before jumping on scooters toward the nearest highway. On Friday, Bocker, the German machinery company that made the lift, entered the conversation, releasing a cheeky post featuring an ad across its social media pages. The ad features a photo of its ladder propped against the Louvre's facade with the caption, "If you're in a hurry, Bocker Aguilo carries up to 400 kilograms of treasures at 42 m per minute, as quiet as a whisper." It was part ad, part wink. Suddenly, the family-run company's longtime slogan, "My way to the top," has gained a new meaning. They weren't alone. IKEA Switzerland posted its own tongue-in-cheek ad promoting a glass dome display case. The caption read, "Won't protect your crown jewels either, but it will give them the right spotlight." Others on TikTok and Instagram have turned the Louvre heist into a Halloween costume. Think black jumpsuits, leather gloves, sleek sunglasses, and glittering imitation jewels. Heists are so back, the fashion influencer, clothes for dinner, declared. How nice to read about a heist rather than a massacre. Part of the fascination comes from the fantasy the story invites. How thrilling upon hearing the news to put oneself in the shoes of the thieves, and imagine making off with the diamonds scot-free. The Atlantic staff writer Katie Weaver wrote in a recent piece, chronicling the public's obsession with the heist. Or to put the obsession even more simply, how nice to read about a heist rather than a massacre. The stolen trinkets, Weaver writes, have garnered far more attention now than they would have had they remained on view at the Louvre for 5,000 years. Perhaps she's onto something, and perhaps that's why Hollywood, for its part, couldn't resist the moment either. George Clooney, who plays a master thief, Danny Ocean, in the Ocean's franchise, joked at a film premiere last week. They seem to have done a pretty good job of getting away with it. I was very proud of those guys. As with other heists might inspire the upcoming Ocean's 14 film, Clooney quipped, "I think we should rob the Louvre." And then there's the dapper man the internet has decided is on the case. After the robbery, an Associated Press photographer captured a young-looking, well-dressed passerby near the Louvre's gate, coat, tie, and fedora, as police sealed off the museum. Online, he was instantly dubbed a more dashing version of the famed Inspector Clouseau from the Pink Panther franchise, supposedly a suave detective investigating the theft. The AP photographer, Thibault Camus, later said the man was simply walking past. "He appeared in front of me, and I saw him. I took the photo." Camus says, "He passed by and left." Still, the image took off, racking up millions of views and a flood of memes. Even the Paris prosecutor's office seemed to play along. In a reply to AP regarding whether the mystery man was part of the official investigation, officials replied with a wink, "We'd rather keep the mystery alive." Coffee-driven deforestation is making it harder to grow coffee, watchdog group says. Coffee plants are seen at the Brazilian Agriculture Research Corporation experimental farm in Brazil in 2022. Coffee production in Brazil is leading to deforestation, a nonprofit group says. As the world's thirst for coffee shows no signs of slowing down, widely used practices to ramp up the crop's production has become self-defeating, according to a nonprofit watchdog group. In Brazil, the world's biggest coffee producer, coffee farming is driving deforestation, and that, in turn, makes coffee harder to grow. More than 1,200 square miles of forest were cleared for coffee cultivation in Brazil's coffee-growing areas between 2001 and 2023, according to a new report from the group Coffee Watch. The group used satellite images, government land, used data and forest loss alert system in its analysis. Overall, in areas with a high concentration of coffee growing operations, a total of more than 42,000 square miles of forest are now gone, the report said. This includes forest loss caused directly by coffee farming, where land was cleared to grow the crop, as well as indirectly from nearby road and infrastructure projects. For example, coffee essentially punched a Honduras-sized hole in Brazilian forests, says Etel Higo, Coffee Watcher's founder and director, noting that the Central American country has a smaller land area to what's been lost. To be clear, coffee is not the leading cause of deforestation in Brazil. Cattle ranching is responsible for a far larger share. Higo notes, but she says coffee's role in deforestation has not been talked about enough. Scientists have shown how deforestation leads to less rainfall in tropical rainforests. That's because the trees there soak up and release moisture, which rises to create clouds and more rain. Cutting down trees disrupts the cycle, reducing rainfall and leading to drought. Drought, of course, makes it harder to grow coffee. When you kill the forest, you're actually also killing the rains, which is exactly what your crop needs to thrive in the long run. Higo says, even for people who don't care much about climate change and mass extinction, if they drink coffee and care about having coffee in the long run, this should be very scary for them. Most years, the past decade have been rainfall deficits in Brazil's major coffee-growing areas, the report says. Farmers are expanding to respond to the world's insatiable demand for coffee, says Aaron Davis, a senior research leader of crops and global change at the Royal Botanic Gardens, Kew, England, with a long-time focus on coffee. And to produce that coffee, you need land, simple as that. Davis says the report is timely and useful. He was not involved in the study. This will help to provide metrics on deforestation and start the conversation around the influence of coffee production on forest loss, he said. Coffee Watch's Higo credits Brazil's current administration, under leftist President Luiz Inácio Lula da Silva, with making progress against deforestation. Brazil's Institute of Environment and Renewable Natural Resources, which works to prevent deforestation, has not responded to NPR's request for comment. Higo reports spurs of coffee businesses to refuse to buy coffee that was grown on deforested land. The National Coffee Association, a trade association for the U.S. coffee industry, has not responded to requests for comment on the report. More environmentally sustainable coffee growing methods exist, such as using shade trees to shield some plants from the sun and diversifying crops. But these methods typically don't yield as much coffee as industrialized production. Higo says the coffee growing areas they studied in Brazil are, by and large, not using the sustainable agroforestry practices. Davis adds that more needs to be done to reward farmers who are being more sustainable. He says that responsibility to encourage more sustainable coffee production extends to consumers. For coffee drinkers, Davis says, I think there needs to be an awareness and a mind shift around the implications of purchasing products like coffee.